morning. Welcome back to the podcast. I'm Dr. Krista Vernaleken.
And I'm Dr. Lindsay Renzullo. It was nice summer break, huh, Krista?
Yeah, I missed you guys.
I know, I missed you guys too. I really did. I saw Lauren and Rachel had a little clip of that we're coming back and they were posting it on social media. And just seeing our faces together doing the podcast made me happy and excited.
I mean, we do see each other many days at work, so it's not too bad.
Yeah. True.
So today we wanted to welcome Chris Hughes and Mariesa Hughes from the Mr. Mo Project, and welcome. Very happy to have you.
Thank you very much.
Thanks for having
us. So let's start, I think, by just having you guys introduce yourselves and tell us a little bit about your work.
So I'm Chris.
And I'm Mariesa.
We run a program called the Mr. Mo Project. Started it back in 2014 after our dog Moses passed away, and it's dedicated to basically helping save senior and special needs dogs.
Oh, it's awesome.
So I was looking a little bit at your website, and definitely encourage our listeners to go and check out their website as well. It's a really unique program that you have, and I haven't seen something quite like this, although there may be others elsewhere. But so you provide lots of different services for people, so adoption services for older pets, but also some financial assistance for owners to try to have them keep their pets. Is that right?
Yep.
Yeah, so it's kind of a terrible idea, but it's worked really well for the last 7 years or so. We pay all of the medical expenses for the senior dogs in our project, so they remain in forever foster homes, so we can cover those expenses. And it's opened up a lot of really great homes for people who don't have the extra income for a senior dog, who often come with some kind of medical condition. But also it's allowed people who do love their dogs that have medical issues to keep their dogs. So we cover some financial expenses for those folks as well.
Oh, that's amazing. That's awesome. So a lot of these dogs that are senior dogs, how do they sort of end up at the Mo Project? Like, how does somebody find you or find their dog to sort of end up there?
So we work with a lot of different shelters. We work with the New York City shelter a lot. We're a New Hope partner with them. And I think we've kind of built a reputation of doing what's right by the dog and cat sometimes, and have kind of built this reputation. And now people reach out to us from owner surrenders to hospitals. We get a lot of calls from different hospitals about dogs that are maybe hit by cars, stray dogs. People bring them in, can't afford care, don't really want the dogs. So they come to us in many different ways.
Yeah, it feels like there's a lot of reasons why some owners choose not to adopt a senior pet, and some of it is just that they get attached to them and they don't want to lose them quickly. But, the daunting idea of medical care it's a big thing. They're surrendered for a reason. And I think, I don't know, Lindsay, if you agree, but a lot of the times we see these pets that an owner will bring in as a new adoption, and it might be an older pet. You can tell that probably the reason it was surrendered was because it had 18 problems,
Yeah. And I think by taking away that financial burden, it allows us, like Mariesa said earlier, we found some just absolutely incredible homes with people who they have all the love to give. They have the house, they have everything but that additional income, because we spend about $60,000 a month on vet bills.
Yeah.
And when a new dog comes into the project, you're looking at least $1,500 at a minimum just to get the diagnostic work done, X-rays done, make sure we have baselines on everything.
Oh, that's amazing.
So do you kind of do that type of an assessment, like when a pet is brought to through your project, you just do kind of what it needs in order to figure out what the spectrum of issues are?
Yeah, when we get a dog from a shelter, it goes to our vet initially. So oftentimes, especially with New York City, although they do a tremendous job, they're just such a high intake shelter. Yeah. A lot of the dogs come to us with an upper respiratory infection. So we always house them in isolation at our vet and start antibiotics. But we do like a senior wellness panel. So we'll do blood work and x-rays and see
Always
what
check
they,
thyroids.
yeah, we have a lot of low thyroid and a lot of mast cell tumors for some reason. It's just kind of like the Mr. Mo special.
Yeah.
So we typically have them at the vet for about a week before we even place them in a foster home, just to let that incubation period happen for their kennel cough or upper respiratory, and then let the antibiotics kick in, and then we'll place them in a home. And once they're in their home, then we'll schedule their dental or their mammary mass removal or their spay or neuter, whatever needs to happen after that. So we just really like to have that baseline of x-rays, because then in the next 6 months or a year when we do it again, we can see that change in, you know, they have arthritis or they have this little mass that's grown on their spleen, or, you know,
Their heart's bigger, you know, dealing with the, you know, looking at the organs and all that stuff.
Yeah, so we really don't withhold any kind of treatment. We've done hospice, but not that true like palliative where we don't treat something and just love them. We've always treated with whatever we can, but we've certainly consider quality of life and let a dog go or cat go when their quality of life is no longer.
You had mentioned earlier that a lot of these places that you put them into after are forever fosters. So does that sort of mean that like these people that are taking on these pets are sort of, you know, utilizing you guys as a point person as far as the care of that pet, or are they sort of dictating a lot of the care of their pet? Okay, yeah, you said so shaking your head.
Yeah, we take, I mean, we work with our fosters very closely. Obviously, they're with them all day, every day. You know, when it comes to quality of life, when it comes to, you know, their well-being, they're obviously a huge part of the decision-making for any treatment plans. But at the end of the day, because we're covering all the costs, we are kind of the final, if we're going to do certain things, you know, if we're doing an MRI on a dog that, you know, what are we going to do with the results? And, you know, that's kind of what we always ask ourselves is, all right, are we going to spend $2,000 on MRI? Are we going to do a surgery? If we're not going to do a surgery, why would we do the MRI?
But I will say we have learned so much in the amount of time that we've done this, because 7 years ago, if somebody said this dog needs an MRI, we would have been like, what can we sell in our house to get this MRI? Even though we couldn't use the information, we would have done it because somebody said the MRI. Now we take a step back, we talk to our vets who educate us so beautifully, and then we can talk to our fosters and say, this is why we do this and this is why we don't do this. And they tend to understand it a lot more. And we talk about our experiences.
We can sometimes be a bit of a pain into the vet world sometimes, because we have been so well educated by the doctors we work with, where we might question a lot more than the regular, you know.
I'm sure you're not a pain.
That's actually the best owners are the ones that are like, I'm such a
owner.
pain because I got all these questions. I'm like, no, bring it on.
You're not a pain.
It's sometimes like we've tried things and we've done different things because we've worked with so many different, you know, we work with so many different hospitals that have so many incredible doctors. And, you know, the Capital District Vet Referral Hospital is where that's our main like emergency vet. That's where when we get these critical cases that come from the shelter, that's the first place they go. And they're just so thorough on everything that when the dog comes out, like we know so much now. Right. So we can go to our general practice and we have a very good, you know, kind of an understanding of what the next steps are.
Well, I think that's such a valuable, like, you know, lesson that you've learned. And we try to tell this to our clients too, as well. I mean, anytime that we're going to do something, like we're doing a diagnostic test, like, yes, you could do ultrasounds and everything and x-rays and everything. And MRIs. But what are we going to do then once we learn from that information, right? Are we going to go ahead and proceed with the next step after that, right? So I think it's a good point for all owners, you know, regardless of being in your foundation or not, you know, it's something where, you know, really realizing that just because you can do something doesn't necessarily mean that you should, because there can be lots of different ways to sort of go about things. And you know, medicine is not black and white. It's not saying you have to go down this path on every single patient. You have to look at each patient, what's right for them and what's right for that owner. So I think it's a good approach. I'm sure you're not a pain. Yeah.
Yeah. We'll skip that.
We're just thankful for being so well educated by the vets that we work with, and the fact that our vets work so well with our primary care doctors as well.
I feel like I could pass like 20% of the veterinary board exam.
Only for dogs.
Maybe
Only
the small
for
animal
dogs.
portion. Yeah, the dogs and cats.
For dogs, and probably a lot about mast cells.
Yeah. Some onco, some cardio.
Yeah.
I could take some wild guesses and be close.
Always guess C.
Yeah. C. Why C? This is how she got through her. This is how she got through her.
I pulled up this vet like online vet test, and I was quizzing Dr. Gavin, who's a good friend of ours, but also is one of the vets and I'm just going through and asking her. She's like, we don't even know how you need to diagnose, because she could answer them before I even gave her. She didn't even need the multiple choices, and she was just like, "Oh, that's what it is." I'm like, "Why do you even diagnose?"
Yeah,
it's really incredible the amount of knowledge that you guys have.
So I know you've alluded to this a little bit in some of the conversations. What are some of the more common things? You said mast cell tumors and probably a lot of different types of tumors that you see. Are these the reasons that you think these pets are being surrendered often, is that they've had some diagnosis and the owner can't really provide the care?
We get a lot of skin allergies, like bald dogs. We get a lot of mammary ulcerated tumors. I mean, like terrible.
The smell will stick in your nose forever.
Ulcerated mammary masses. The majority, knock on wood, which I don't want to do because the dogs will bark, have been benign.
Yeah.
Which I'm super thankful for.
We had a really weird string of limb strangulations with people not grooming their pets. Then all of a sudden, like the leg, like we have a dog here, her name is Delilah. I will never forget when I picked her up from she was surrendered to the Philadelphia SPCA. Basically, they said, you need to surrender the dog or we're going to press charges. This was an awful, awful cruelty case. And we took her, and I went and picked her up, and they opened the back of the van, and the smell was just, and the leg, just the hair had matted so badly around one of the limbs that the leg was completely dead.
Oh wow!
And it was amputated, and she was like this scared little dog when we picked her up, and now she runs this house like
my gosh,
she's like a complete police officer.
Yeah, she's a fun police.
Yeah. But we had a really weird string of probably 3 or 4 limb strangulations within a few month period. With young dogs.
Yeah. So is there an age requirement, or it doesn't necessarily need? I know you had sort of said or alluded that you wanted more of a senior dog or a senior animal, but is there really an age requirement?
Yes.
There's a crying requirement. If you call us and cry, you're pretty much a done deal.
I think it depends on who you call. Like if you
call me and cry, I'll be like, "Get it together, sister." If you call him and cry, he's like, "Where are you? I'm on my way."
I'll probably cry with you, and then we'll figure it out. Like I'm 6'4", 300+ pound, former power lifter, and she's tiny little Italian.
I don't do the crying.
The ages, we do really try to stick to senior. I mean, that is the mission is senior dogs. But we have really started branching out a little bit into special needs. We do a lot of congenital defects, cleft palates, neurological, spinal. We try not to.
We have formed a relationship with some breeders, which I feel like is very important. Just to educate them about congenital defects, to not euthanize immediately, that we will take their dogs, no questions asked,
and at least attempt it.
No blowing up anybody's spot, just, please give us the dogs and continue to do what you do, but to educate them about testing for congenital defects. And we've been able to work pretty well with one person. And
it's a tough relationship though, because like you'll see like your friends on Facebook and you see them post, "Oh, I'm selling this puppy for $8,000," and I'm like, but then we deal with like Nutmeg is a puppy we got when she was 2 hours old, and nobody thought she would live. She actually at 2 hours old she went to Capital District because she had already aspirated, and we just celebrated her 1-year birthday. We tube fed her for the first 6 weeks of her life, and she just had the cleft palate surgery at Cornell because it was so big she had to have it.
Yeah.
But we've been successful on some, But so I guess long answer, yes, we are senior based, but we will take medical conditions. We don't do well with behavior. We don't have behavior fosters. We're not great with like aggression issues.
Yeah, that's tough.
But the more medically challenged, really, the more we are kind of wanting to get involved. Like the Tito is this little skin and bone dog behind us with malabsorption, diabetic. Like it is the hardest. Trying to get this dog balanced with his blood glucose has been such an incredible challenge. And, the medicine side too. So we like those types of challenges.
Well, with that said, with a lot of the senior dogs and the medical stuff, I mean, it's been, I think a listener might hear this and think it's daunting, but in some ways, like, isn't it very rewarding too as well? Like, would you say, like, what are the benefits of really having a senior pet over like a brand new puppy, right? So like, do you find, some benefits that you can really point out as, doing this for as long as you guys have of what's, what the senior pet brings?
Yeah, absolutely. I think, for me, I'm just a senior. I just love seniors in general, like people and pets. But, when you take a senior from any situation and you know that they've been loved, usually the majority of their life, and they're kind of shut down, they've lost their person and they're feeling kind of punky for whatever reason, and you bring them into your home and they start to trust and start to feel good and start to love and pick up a toy for the first time and go in the yard and sniff around. Like you see them blossom and open up, and it is the most rewarding feeling. Like you feel like you've just saved the world in this one dog. It's truly, puppies, they play already. They're happy already. They don't know any different. You have saved this dog more than you'll ever know when you save a senior. It's tremendous. Absolutely tremendous.
That's awesome.
I got to turn this around because this is, look at, I don't know if you can see.
Yeah.
Yes.
Yeah.
Falling off of the bed.
She's just too big.
Oh, yeah. And then I like the ones on a mini trampoline. Is that one on the mini trampoline? Is that what I saw too?
Oh yeah.
Yeah.
Okay.
So Mariesa is an occupational therapist by trade. So she tries to bring in all these therapy things for these dogs. Like we have weighted vests.
That's awesome.
And the cocoon swing. Nutmeg is very sensory seeking, and so those things work really well for her. Because we haven't medicated her yet. I say yet. We're close.
She has a brain. She has fluid on her cerebellum, and her fine motor skills are not so fine. So we try to figure things out here.
So I'm curious about whether you have pointers or things that you wish that people would keep in mind when they have a younger pet, and in order to avoid their pets ever being sort of in the situation where they're faced with all of these compounding medical problems.
So go to the vet regularly for don't
shameless plug.
That was like a softball you threw him.
I know.
Yeah. The amount of times we'll get a call from the emergency vet for a dog that needs to be surrendered to us because they have this insurmountable amount of, always comes with, they haven't seen a vet ever.
Yeah.
So I think when all right, you're getting a dog, you need to, know in your head, you need to budget for $500, $750 a year in your blood work and your just general medical. And if you can't do that, then it's maybe not be the right time to get a dog. Because these are 15 plus year commitments. We have a 22-year-old dog here. Like this is a lifelong commitment, and it's very hard to take a dog at this age that has never seen a vet, and now we're dealing with issues that so easily could have been treated, pyometras, prostate issues from just spay and neuter and all that. So yeah, see a vet regularly, at least once a year for a younger dog, once every 6 months for an older dog, and it'll cut down way on costs in the future.
Mm-hmm.
And now go ahead.
I was just saying, a lot of the time I see pets that are, they're seeing us, but a lot of the time it's, there are things that we really would like to do. We would like to do those routine dentals and cleanings before they become that you have to remove every tooth in their mouth. You'd like it to be that you keep up with that so that now you don't have a 17-year-old dog or cat that that has heart problems and diabetes and also needs its
Right.
teeth done now because the teeth
Yeah.
are rotting out of its mouth, right? Like there's all those things that you might consider them kind of optional going along, routine blood work and, you know, the dentistries. But now if you have to wait and delay that care, now it's $3,000, you know?
Yeah. No, and I was going to say, I mean, we felt, you know, the veterinary industry felt a huge surge during COVID, right? So we were busier and felt a lot more patients are coming through our doors. The pet ownership had sort of increased. Have you felt that same sort of surge or a bump, you know, since COVID has happened?
Yeah, we had a lot of dogs were surrendered to the shelter, especially New York City shelters at the time. Two times actually. So people who passed away or were hospitalized due to COVID, and dogs were in the shelter. And then the second surge was people who went back to work and brought their dogs to the shelter.
Yeah, that's true.
Yeah.
Yeah, I'm keeping an eye on all those news. You know, there's some news reports that say that that's starting to happen, and then there's some that are, you know, like, oh, it's actually not happening as much as we feared. So we're kind of keeping our fingers crossed that that the COVID adopted pets remain in their homes and, you know, don't have to be surrendered. But, you know, I guess time will tell.
It's a lot of behavioral ones that we're seeing in the shelter.
Yeah.
Ones that have separation anxiety and ones that are not great for our group to take.
Yeah.
They're all going to sit.
Well, yeah, because you guys have, I mean, we were talking before the show actually started recording. I mean, you have in your home how many animals now currently?
We have 19.
19. Yeah. That's fantastic.
They're
Are they
like-
dogs and cats, or are they all? I mean, they all have to get along. That's the thing, right? So
They're
you
all
can't have a
dogs.
behavioral problem where they don't really like each other.
Yeah.
Well, we do have some behavior. We have a very like incredible group of dogs that from big to small. We've got greyhounds, we've got chihuahuas. We have 2 pitties. We have a nasty little French bulldog.
Those Frenchies.
But he's got a hemivertebrae, so he's not all that quick. So we're more like a bowling ball. But we have an underwater treadmill in our like a hydrotherapy treadmill
Oh, wow.
in our basement because of him.
That's awesome.
He's he walks now. When we got him at 8 weeks old, he couldn't walk from a breeder.
Wow.
And now
we have 3 pitties.
We have
3
3?
pitties. Nutmeg.
Nutmeg. Yeah, nutmeg.
We have a German Shepherd with like half a jaw. He desperately wants to be a police dog, but they won't let him.
He is
Aw.
they think he like bit into a live electrical wire. Like the front of both of his top and lower jaw gone.
Oh yeah.
He's
That's
a funny
intense.
dog.
Yeah.
So so we have a house full. They're all just randomly. Mariesa works from home, so she is here with them all day, and I work for the Special Olympics New York. I have to go to an office.
That's awesome. And so, I mean, going back to about those older pets, I mean, these are pets that you know the personality of, right? So you can kind of feel them out as adults, and you can place them in homes that you know are going to kind of gel and be perfect for that dog, which is really, really a big benefit of an older dog too, as well. I feel like a lot of these older dog adoptions, like you sort of said before, I mean, they're grateful. They're so grateful to have a loving home.
Yeah.
And you can feel them out already. So you already have a little bit of a heads up on, who they are going to be, are they needing a lot of exercise? They just want a lot of love, what is sort of their thing. And I think that's a huge benefit of adopting an older pet.
And a lot of them, they just want a bed. They want a space. They want a lap to lay on. They want, and it's much easier finding a home, at the end of the day for a dog that's pretty calm and pretty laid back. Maybe has some, potty issues that we work through.
Right.
That's really the major issues you're working through, are more, behavioral in the sense of like training.
Yep.
But we have some puppies here that are nuts, absolutely nuts. So we have a quiet house without them.
Puppies are a lot of work. I don't know why we did that, but they have made our seniors less senior. And they really seem to enjoy that. So that's nice to see.
Awesome. Now, I don't think we talked about like the funding, like as far as your project goes. How do you guys get the funding for that? How is that sort of arranged? Look at Marisa's face.
Big. This whole project started off of realizing how expensive everything. Like we sold our hot tub to pay for Moses, who the project is named after. We paid for his MRI by selling our hot tub. And then we realized like this is super expensive. So we've done everything from auctioned off her wedding ring when we first started to try to raise money, and you know we did a raffle for it was like an engagement gift, to just begging, and I shaved my beard for $1,000 donation. We are not shy. We will literally do anything we're committed to the 130 dogs. We do fundraisers, we do t-shirts, we mostly social media stuff.
Yeah, that's awesome.
Because we spent $700,000 last year on vet bills.
Wow.
So that's our goal that's what we have to raise each year.
Right.
So.
Absolutely.
So I know you mentioned a little bit about some individual cases that were particularly memorable to you. Do you have any other cases or patients or pets that you wanted to highlight?
There's actually a really cool one that actually came from Capital District. His name now is Lincoln. He was found on like a riverbed down in where we are, and he was brought in by a Good Samaritan, and he was super sick, but they couldn't figure out why. And I believe it was Dr. Rogers did an X-ray, and he had this tiny circle, and they were looking at it, and they're like, I think that's a penny. They're like, because it all kind of set up for zinc toxicity and how sick this. And they're like, what do we do? They couldn't do the surgery there, so we ended up picking him up, taking him to Cornell, where they were able to surgically remove this penny. Mm-hmm. And it was just such a random find that I remember Dr. Rogers looking at it, and like they all were like, what? And they thought it was a penny, and ended up being right. So they started treating him for the zinc toxicity, and he actually ended up getting adopted by the student at Cornell that got called in to assist with the surgery that night.
That's always how we get our pets.
It was just I had never thought about it, like a penny creating so much of an issue, and
it causes in these dogs, for the viewers, this hemolytic anemia, this type of an anemia, right? So they have basically no red blood cells to sort of oxygenate all of their tissues. So these pets come in so sick, and finding a penny is like, I feel like finding the pot of gold, because if not, then you get worried about it being some awful immune mediated reaction, which can be really sometimes tricky to manage and get them out of that. Whereas a penny, you go in there and you remove the penny, and now you've removed the source of this problem, and then they can get better really quickly. So
do you know the trivia about what age pennies you have to be worried about?
Oh, I know. Like 1980 something. Like
yeah, you're close.
Yeah.
Me too.
Yeah. So for the viewers, before 1982, pennies were comprised largely of copper, and after that, they changed over to more zinc, which is more of a toxic metal. So in theory, if you knew the age of the penny your pet ingested, it would be helpful, but
Yeah. Which is really weird, because I guess human children, this was posted on one of the mom boards, that, talking about human kids eating coins. And I don't think it has the same manifestation in humans.
Do humans have the opposite? They're like toxic to the copper part?
Well, no, it almost is like they weren't even as worried that, if humans eat it, they're not as concerned about them getting this horrible anemia. Weird. They just wait to see if the penny passes. I'm like, I would freak out. I'd be like, get it out of them.
Get it out. Yeah.
Yeah. That's yeah. Do you have any stories? I mean, there's so many. There's like 500-600 dogs that have come through the project. They've all, I mean, Delilah, I think the one here has been just an incredible story of a turnaround. Nutmeg is a dog that I thought was going to die 3-4 times. We've done a lot of hit by cars that have crazy surgeries that end up doing great. I think it's just, they all kind of culminate into just a lot of stories.
Yeah, that's awesome.
A bunch of cats.
Oh yeah, we have. Yeah, once you take one cat, then the word gets out that you take cats, and it's never ending for cats.
When did that start? When did you start taking in cats?
I feel like it's with Dr. Gavin.
Mm-hmm. Dr. Gavin's a good cat person. She's like, will you guys help us with this cat? Sure. Peaches was a cool dog not Peaches. Pumpkin Spice was in Florida. They were the shelter in Florida. They were gonna euthanize her because they couldn't figure out what was what was wrong. They couldn't medically manage it. It had a portosystemic shunt.
Oh yeah.
And a liver shunt and a what is it? A PDA, patent ductal.
Just all the things.
Yeah, and they couldn't figure it out. There were some neurological issues going on. So I actually flew to Florida, from Jacksonville, picked her up, and then drove her back to New York. And we went through the surgeries, 2 surgeries, and she's doing great now with foster.
But they couldn't fix her.
They couldn't fix
liver.
the shunt. Yeah, the liver. There was something that there was no. I don't know. You're the doctors. There was no. What was it? There was no.
Some artery, maybe there was something.
I wonder if it was. Sometimes there's a single artery, and then sometimes there's multiple ones. And if there's a single one, they can usually fix it. But if it's multiple, and it might have been related to the PDA, I wonder. Yeah.
The PDA was successfully fixed here. It's a nightmare for the male people. We've so many times we've caught the male people taking pictures of all the dogs in the window. So many.
Well, that's the thing. They go back to the post office and they're like, "Look at this place."
Yeah. We have a big blue pit bull named Stig who will actually get up on the dining room table and sleep on the dining room table.
If I was, yes, I would.
It's so comfy. It's just so comfy.
Totally.
He finds the sun and it's away from the small dogs.
Yeah, there you go. Like his little perch. That's adorable.
I think Brownie is a great story. Brownie was one of our dogs we got from New York City shelter in heart failure. They said she might have about 2 weeks to live. They did this Hail Mary kind of treatment, just gave us Rovera for her heart because sometimes that helps. And she made it 2 weeks, and then she made it 2 months, and then we did open heart surgery in Florida with this amazing surgeon, Dr. Pelosi, and then she lived 21 months.
Yeah.
Wow.
That's awesome.
And she was my heart and soul, just by my side all the time. I'd have to tell her, like, she'd be falling asleep next to me while I was doing dishes, and I'd have to be like, "Brownie, I think I could finish this without you. Go ahead and lay down." And she'd be like, "Oh, thank God." And she would just collapse and could fall asleep.
She was very grateful for everything.
Oh,
and
she was such a good girl.
Just hang by your side for anything.
But like, just taught us so much. I mean, specifically that age is not a disease.
Yep.
That a diagnosis is not a death sentence by any means. And just don't ever take it as such.
Yeah. I love that.
Yeah, that's always the biggest. I think, as a vet, a lot of the time, so half the time we have these pets that come in and, I leave the room and I'm like, I can fix this dog, but, whatever is standing in the way. Or, if this was my dog, I'm like, this is how I would do it necessarily. But of course, owners can choose whatever, path they choose. But I hear so often from older pets, owners of older pets that like, well, he's old, so we're not going to do. And it's interesting because it seems as though the older the pet gets, the less likely people are willing to put the funds into them. But that's when they really need it and would benefit most from it. And I just find that it's just hard, and it's interesting that that's sort of the psychology. Like once a pet gets past 14. It's like, well, whatever happens, we're just not going to do anything, even if it's a fixable thing.
I just I don't get that mentality. And
I mean, I feel like we need a shirt that says age is not a disease.
Yeah.
Like, I don't know why we haven't done that now.
It is something that, I mean, just people I know, well, he's getting old. I'm like, it doesn't, I mean,
we're all getting old.
It doesn't matter.
Don't stop caring on me.
You still have that commitment to the
now
care,
more than ever.
And now at 14 when the dog has a UTI and you're trying to say, oh well, he's old, we're just going
$20 antibiotics.
It's just I could get mad about that. I'm not going to.
I think that should be your next t-shirt, your next fundraiser. There it is, right there, Mariesa.
I just
I'm on it.
You're on, like you committed and
that's why we committed.
We do this. But we have some of the most incredible fosters and some of the strongest fosters to be able to openly take in, you know, a 14, 15-year-old dog with all these medical issues. We're going, Mary Mahar, she took a dog named Odie that had lumps and bumps and everything, knowing that this dog does not have, you know, years of life left, but she has just loved this dog. Today, Wednesday?
Yeah.
He's being put down today, actually. Oh. We talked to her on Monday, and she, you know, he's lost the use of his. He's like a, what is he? Dachshund, like a big wired hair dachshund, and he's basically, you know, lost the use of most of everything now. So quality of life time, but she's only had him a few months, and she knew it. That's what she was prepared for, and she told me on the phone Monday. She's like, "Hey, this is very hard, but you know, I'm willing to take another one," and that's just a huge amount of strength for somebody to go through. I've always looked at it, I think, a little differently than you have, and it might be very dark in a way of saying it. I would rather, you know, bring them to our house and have them live here for a few weeks than, you know, stay in a shelter and just, you know, their final resting place is a plastic bag. That's, you know, that's why I think I can handle the loss a lot more so than Mariesa, who takes the loss very, very hard.
Yeah, it is. I mean, I've, you know, not always actually intentionally in my life, but I've often taken on little hard luck cases. And, you know, I can just remember that, like, you know, I had this dog that I adopted in vet school, and I always intended to get, you know, a younger dog just because that's what people did. But it, you know, that rescue wasn't necessarily good at aging the pet, and it ended up being probably an 8-year-old basset hound. And, you know, I had him for a wonderful 3 years. And like, I wouldn't change that for anything, you know, and I gave that dog, like, he had probably 3 owners before me, and I gave him hikes through the streets of Philadelphia, you know, and Wissahickon Park, and like, I used to take him out to Valley Forge and do these weekend things, and he was just like my salvation during vet school. And so, you know, just because I had him for 3 years doesn't change that like wonderful experience. And I think that's the thing that people, you know, adopting a senior pet that has a lot of medical conditions and it doesn't have long to live, you're still giving it a wonderful time. And at least like you sort of, you know, that your time is more finite. And I think, I'm not saying that that's easier, but it's, some people will adopt a puppy and only have 3 years with them because of something sort of tragic that happens. And that kind of thing like hits everyone really hard, but like just knowing you put everything into those pets, I think is worth it.
Yeah, no, I agree. I think you make the most of your time when you know you have less of it.
I love that. Well, you guys are doing absolutely wonderful work. I cannot thank you guys enough. A huge thank you to both of you guys. So both Chris and Mariesa, follow the Mr. Mo Project and Ethos Veterinary Health on social media for more information and find out how to donate. I mean, they're looking for it, so help them out.
Save their jewelry.
And also, huge. We thank our vets and our hospitals as much as we can. We try to do as much as we can. So thank you guys. It's not easy, especially now where the vets world is so overrun with all the COVID pets, and you guys are just getting hammered left and right. Staffing is difficult, and it's really I feel like a thankless job a little bit in the sense that you don't get the thanks that I think you guys all deserve.
But we thank you.
We really appreciate it.
You're doing a great job.
And on that note, on thank yous, we'll also thank our sponsor, Ethos Veterinary Health. And don't forget to subscribe, rate, and review us on your favorite podcast platform or on YouTube. So I'll say goodbye. Dr. Christopher Vernaleken.
I'm Dr. Lindsay Renzullo. We'll see you guys next time on the podcast.
Thank you.